I have worked in Africa on and off since 1989. I work predominantly in rural communities in Zambia, building up very strong and close relationships with the communities who lived in those areas and witnessing many of the challenges they faced. And I was driving down a very remote track, a dirt track, and as I went down this track I started to see drops of blood as I went, and as I kept going I saw more and more blood. Now, at the time I was very close to a national park, and I thought perhaps a lion or a leopard had killed an animal and dragged it up the road. But as I came round this sort of big bend in the road, I saw a man cycling his bicycle with his wife sitting on the handlebars, sort of resting against him for support. Now, in most circumstances, particularly at that time, that wouldn't be uncommon. People often, have or carry passengers on their bicycles. But in this instance, the woman was very heavily pregnant, and the blood was coming from her. She was in a very poor condition. And so I stopped, and I helped them both into the back of the vehicle. We laid the woman down in the back of it. It was a pickup back of the vehicle, and I drove as gently as I could to try and get to some sort of help. As I drove, I asked the man what had happened, and he told me that he'd taken his wife to the health centre just outside the little village where they lived. But the health workers just couldn't help them. I mean, she needed emergency care. She needed to get to hospital quickly. But there was no ambulance. There really was no motorised transport of any description, and I just happened to be coming along. And as we drove, the woman just very quietly passed away. And there was absolutely nothing I could do about it. There are certain events that can take place in our lives that act as a sort of a catalyst to make us want to do something. And that experience, at least for me, was the catalyst.
Virtual Doctors is essentially a telemedicine charity, and its primary function really is to link clinical officers in rural health centres to doctors who are currently primarily based in the UK, who help them to diagnose patients. We have our own app on which clinicians might enter the symptoms that the patient is presenting.
We don't have a lot of doctors, especially in rural areas. Most doctors are based in the urban areas. So that makes it difficult for them to be able to have access to, for patients to have access to a doctor. So mostly the clinicians that they will have access to is a clinician or a nurse who is able to manage their case.
There have been challenges around the number of healthcare professionals, and the government has been doing quite a lot in that space. They've recently recruited quite a lot of nurses, and they continue to do that. The government also has donors and partners who are helping to enhance healthcare, and we're just a component of that.
Having an app such as the Virtual Doctors, it helps bridge that gap where patients then can now have access to a real doctor, and within 24 hours they're able to get feedback on, on how they can manage the case, and also it cuts down costs on the patient where they have to travel long distances to the hospital where the doctor is. So that helps then the clinicians to be able to treat patients within their communities without referring them to the next level of care.
We are on an expedition called Livingstone Revisited 2024, and it's a multidisciplinary project really that brings together a range of doctors, safari guides, members of the Virtual Doctors team, and we're travelling around 3,000 kilometres around Zambia, visiting various clinics to onboard clinicians. We are also running some trauma training as part of a larger pilot project, and also linking up with Snake Safety Zambia to do some snakebite training, and we're also distributing solar lanterns.
It's been very hot and dusty. We've been camping along the way. We've taken a very specific route going north, but we wanted to incorporate elements of Dr. David Livingstone. There are sort of parallels. He was a medical doctor. He came through Zambia in the 1870s, through the different communities, following the Arab slave routes, and also trying to find the source of the Nile. So we wanted to sort of build it around his roots, and then look at the health facilities that we're already supporting along route and visit those clinics. So we're here in Charitable district, which is in northern Zambia, and we've just chanced upon this stone which commemorates the visit of Dr. David Livingstone, who came through here in 1873. He was on his way to try and find the source of the Nile, and he came and was officially greeted by the Chief Chitambo, who's still here. His descendants are still the chiefs to this day. And Livingstone was greeted here and unfortunately died not far from here about a few weeks later. He had complications of malaria.
That's where we'll be going a bit later. We've also just saw one of our wash stations. During the pandemic, we did a lot of work equipping the health centres that we support with foot-operated hand wash and soap dispensing stations so that they were able to wash their hands, when caring for patients and things like that. So we've got one here. It's clearly been out in the sun for a little bit. It's no longer got our sort of red logo, but it's great to see it's operational. Still providing water for the clinic and still helping with water and sanitation.
The team wanted to try to incorporate some trauma training. For example, how to deal with a road traffic accident.
Through our application, we've had 17,000 cases, and we know that clinicians often consult with us about trauma. It's a common thing to be asked about, and what we really wanted to do was do a bit of training, but more so do some two-way learning, so to find out a bit about the challenges that clinical officers face when managing trauma, because we obviously have an idea how we do it, but that's irrelevant when it comes to running a training session in Zambia. So it was very much an idea of getting more information of how they manage trauma, but also thinking about how can we then cascade that from clinician to layperson, because often it's a layperson who will be the first responder at one of these scenes. And then we want to expand on the pilot we've done during this journey, and in conjunction with the Ministry of Health, hopefully expand that throughout Zambia as well.
From the knowledge that I've gathered, I've actually learned that we can actually help those victims save their lives, maybe ensuring they're still breathing, and how best we can actually stop them from actually losing blood.
I've learned how to arrest hemorrhage and also how to examine a patient.
On a virtual doctor's platform, within 24 hours, I'll have a feedback. Not just a feedback, but it's something that you can chat over and over with the doctor that has responded to you on the platform.
When people are open to learning about other cultures, that process happens automatically, because what we learn here influences what is available there and vice versa.
Zambia is a vast country. It is bigger than France, Belgium and the UK put together. The road network, whilst it is improving, is often quite challenging.
We're aiming for a campsite called Croc Valley, where we're going to spend 3 days, and tomorrow we've got our second trauma teaching session as well. But our main task today is to get there, so there's sounds quite dicey, like steep downhill turns with some eroded corners and a couple of river crossings as well, which I think some of them are potentially quite big. So with the drought, it might be though that they've all dried up this year, so we're just going to kind of see how that goes.
Yeah, and he was saying hopefully we should see some elephants and giraffes, maybe some lions if we're lucky as well.
During our expedition across Zambia, we've covered probably close to 3,000 kilometres now. Huge distances, and we've got to see what is a really beautiful country, but we've also been aware of some of the challenges that people in Zambia face every day.
This expedition is a great way to re-engage with many of the health facilities we've been supporting for years, to onboard new health facilities and spread the word, but also for some of our volunteer doctors to actually see what it's like and experience the conditions that these clinicians have to work in, to understand it from the ground. I knew from the very beginning it would be very challenging, because we were trying to introduce something that's sophisticated into a low resource setting. I knew it was going to be a challenge. I knew that it would be a long-term project, program. So I decided to dedicate myself to doing it. I thought, I'm just going to do that. I don't care how long it takes. I don't care if it takes a lifetime. I'm going to do it. I suppose it is the great distances, enormous distances to travel. It is the challenging environments in which these clinicians have to work. As you've seen on this expedition, it's very, very hot, very dusty. They don't have a lot of resources available to them. So we knew we had to develop something that would not be a burden for them, something that would be actually a complementary to their work. It's also financing has been a problem. I put nearly all my savings, my life savings, into getting it going and running it. So money's always been an issue. But I really feel now we're at a turning point where we're beginning to make a big difference. We're in 280 health facilities. Wilson's just set up another 40 users. So I think with the new system we have in place, because we've just developed a new app, we had some funding from Johnson & Johnson helped us to build a brand new system, because the previous one was done by volunteers. I think we can scale this a lot more quickly and a lot more cheaply than we have done in the past.
It's always been designed in conjunction with clinical officers, so that needs to keep evolving. We want to spread that out through the country, continue to engage with the Ministry of Health. And Zambia is just the start. So it all started in Zambia because of Hugh's journey. But these challenges aren't unique to Zambia. So we've already got a pilot in Malawi at eight clinics where we've been focusing more on orthopedics. So the plan is to continue expanding there. And then we've got our eye on other countries, for want of a better word. So we're constantly emailed, and that's not exclusively to the African continent. We get emails from people in South America, the Middle East, Asia. Everywhere people are saying, can virtual doctors come? Can we use that connectivity, that system you've built to try and empower, rural clinicians? The answer is yes, of course we can, but it's just how we go about doing that. And often it's a case of, funding, unfortunately. That's what it comes down to. But I think moving forwards, we've got some really exciting plans. Certainly, we've got some good partnerships coming out of this expedition. Now we want to keep supporting Zambia, work with Malawi, and then see where this journey takes us.